Good evening. Struggling LGBT filmmakers losing money from online piracy. A film distributor attempts to solve the problem. Reconciling religion with homosexuality. A pastor's personal journey to acceptance. And the South Bay comes out for San Jose Pride on this October 2012 edition of Outlook Video. And welcome to Outlook Video, your nationally recognized award-winning magazine for gay, lesbian, bisexual, and transgender communities. I'm Alice Heimsoth.
And I'm Roberta Gonzalez-Gregg. And someone here just had a photography exhibit last month. How was it, Alice?
You know, Roberta, it was great. It was well attended, and I sold some work.
Cool. You know, our viewers may not know, you're quite a shuttlebug.
Flattery gets you everywhere. Da-da-da-da-da-da.
Oh,
Da-da-da-da. And I missed your birthday. Happy belated birthday.
Well, thank you, Alice. It was fun celebrating with all my friends here at Outlook Video.
Okay. And continuing with this month's program, Roberta finishes her talk with Dr. Abraham Jonatan from Banfield Pet Hospital on preventative pet care.
In our 25-year look back, we found several years where we covered Halloween celebrations in the Castro. Later, we will bring you a look at partiers in costumes from 1992 and 1995.
Cool.
Yes.
And if you think you can click that button to watch a movie online for free, think again. Somebody may be making money from your action, and it's not who you intended. Kathy Wolf of Wolf Video, one of the largest distributors of LGBT films, explains the consequences of online film piracy later in the half hour.
He's quoted as saying, "Only God can turn a mess into a message, a test into a testimony, a trial into a triumph, and victim to victor." Joining us later in the studio will be David Harvey, author of the newly published book, Wondrous Love, A Gay Pastor's Personal Journey to Acceptance.
And in addition to missing Roberta's birthday, I wasn't at San Jose Pride. But Roberta and Christine Hancock were there, and will bring you sights and sounds from the festivities later in the half hour. But first, the second part of Roberta's talk with Dr. Abraham Jonatan on preventative pet care.
I'm Thomas Roberts, and you're watching Outlook TV.
Many of you have extended family members of the four-legged kind that we call pets. And like the two-legged kind, we want to keep them happy and healthy. Dr. Abraham Jonatan, Chief of Staff at the Banfield Pet Hospital in San Jose, is here again to talk about taking care of our pets. Dr. Jonatan, thank you again for coming down again to speak about this. We had a nice chat last time about our pets, and we were just touching on the fact that as our pets age, they need a little bit more attention. Can you tell us more about what we need to do to take good care of them?
Dental hygiene is a preventative care that's often overlooked. A lot of the patients that I see have not seen a vet for many years, which ends up getting all their teeth extracted. When you think about it, we brush our teeth on a twice-a-day basis, and we still see our dentist on a twice-a-year basis. So when you compare it to dogs and cats that oftentimes wouldn't get brushed on a daily basis, why won't they be seeing a vet to get their dental hygiene done more often? Dental disease is one of the most common reasons for infections outside the oral region as well. For example, it can actually infect the heart and the major organs such as the liver and the kidneys and whatnot.
What other things can we do for preventative care for our pets?
See, preventative care oftentimes is looked at taking my dog to the vet to get their yearly shots. Vaccinations, first of all, is not yearly anymore. A lot of the big vaccines out there are on every 3 years basis. It doesn't mean that you don't see the vet at a yearly basis or even more often than that. With prevention, the routine workups that you do just to check how the internal body is actually functioning, it's probably one of the best way of knowing sooner of what's happening inside your body.
And you said also that you use x-rays. I didn't know that. I would think of, I kind of connect with pets anyway, at least with x-rays as with broken bones. But how is this preventative care for pets?
X-rays with our older patients, we use X-ray just to make sure to see how the insides are actually looking. With simple radiograph, I could judge on how big the heart is. For example, if the patient is known to have heart disease, I could see how big the liver is. If the patient is known to have liver dysfunction as well. We talked earlier about having all these modalities in the clinic. Most of the Banfields in the United States is actually equipped with digital X-rays, and some of the newer ones are equipped with dental radiography as well, so dental X-rays, which a lot of other clinics will not have.
In finding all these things out for our pets, you also had told me that some pets are kind of susceptible to certain illnesses and diseases, so with preventative care such as this, we can kind of nip it in the bud. Yes?
Exactly. We're sort of catching it early on. You don't want the disease to actually progress on until it's beyond help, essentially. You want them to be seen not long after the disease process itself is showing.
But we can have lots of fun with our pets too, can't we?
Of course.
Yes, okay. And but once in a while they do have some behavioral problems, and you do see a little bit of that, yes?
Yes, behavioral problems. A lot of the times we start with puppy care and whatnot.
Okay.
New clients comes in with 8-week-old puppies and asking about basic trainings and toileting problems.
Yeah.
Behavior consult tends to last quite a while. A lot of my consults last probably 10 to 15 minutes. Behavior consult can last half an hour to an hour, depending on the severity of it. There are vets out there that are behaviorists as their main job, and their consult can last half a day sometimes.
Well, it's good to know that your pet hospital takes care of things on just a wide range, from the puppies to the older dogs and all the other pets in between. Thank you once again for giving us all this great information and how we can take care of our furry friends, and we really appreciate you joining us today. And again, if you have more questions, reach them at banfield.com. Thank you so much for being with us tonight.
You're welcome.
All right.
Thanks, Roberta.